Whātalo whātu tu tuila ma manua e tu saio lau whāsausaunga le nei tu lao le aso. Whātalo whātu fo I tapua inga tu mua ma pule. A mua le nei tai ao, moli atu le limo o le whātalo wha. I le vale lei fo I malana fionga o lo mato whātasi le nei tai ao, le fiona le Lieutenant Kovana, po le tātou car, le fionga ia tala wenga ale, I le nei tai ao, ai me se fo I leo o mai o le sunga I le fionga le whaipule ia ando Samoa, whaia masui o le tātou fono I vaenga I lua. Le nei la tai au tu tuila manua o te wha tu lou atu ia te oe, tu sai fo I o sa mau whai ngā. Tu lou ngalawa. Au le nei tai au o matu o mai o na ua iai fo I se manatu o le malo ma le matanga luenga. Ina ia wha ato o toa tu langa o le se tu atu se tala I le nei tai au, e tu sai fo I ma le tātou COVID-19 community spread. E tu sai fo I ma le whaamtalanga lana fionga le kovana I le po ana po I le declare ina o le tātou code red. A o le nei tai au, wa mato iai ma fo mai, mato whaatasi iai ma fo mai, ina ia tu atu se update po se whaamala maanga e tu sai fo I ma tūlanga ua tātou wo iai e tu sai ma le tātou community spread. Good morning, ladies and gentlemen. Welcome to this morning's press conference from Public Health. We are live to you from the headquarters of Public Health and also our Homeland Security with providing full support. So good morning this morning. We are glad to have the Honorable Carr with us, Lieutenant Governor Talawenga Ale, and also Honorable Representative Ando Samoa. She's representing both chambers of the Fono. We also have the Assistant AG with us to answer some questions in regard to the Code Red. And we do have our physicians available here this morning to answer some of your questions. But first, we would like to explain and provide you with an update of the situation that happened and how an outbreak or a spread happened to our community in the past 72 hours. So, to Tuila Mamanua, without further ado, I would like to turn the floor over to Dr. Lauvao and Dr. Aifili for their explanation of the situation, then we will move from there. Over.
Taimara manoa whaataro whaatu fo mamaru tatotu no ele netu lar tai au. Ia o se ripoti lea au ili atu aisu enga sa whaia lea so ananafi. O ananafi na whaia isu enga mo le pasese na taunu umai lea sus fulfitu February na whaile lato su enga mua le COVID-19. Ma o tulanga lai o su enga lea so ananafi. O whatu ainga. Tolus furu lual pasese ma le au whenga luenga lu tutonu le whatu ainga. O la to iana test negative, ai tasi le positive na moa mai whatu ainga. O le Sadie's by the Sea, e lima tangata malanga lo iai, ma o la to o ma au whainga malanga ma le au whainga luenga, o la sa test negative o ma la to la soana nafi. O le trade winds, se lawi va iwa le pasese o iai temi nei whaapea fwela au whainga luenga. O le pasese, sa negative o ma ia au pasese an nafi se lawi va iwa, ai tasi le tangata whainga luenga, o le matanga luenga so fo malolo ina lo nga lue nei stono trade winds site trade winds sa test positive o le tangata whainga luenga lea sa nga lue foi ile va ale na tau no mai January luas fulfitu lua fe luas malua o ia foi o se tasi o whainga luenga ile va alea sa fa peona ave ese ma le trade winds ina wa yaini si wa test positive ma ave fa no fo ese ile se no fuanga le matanga luenga so fo malolo ina. Ma ila tau fo ia mai le vaa sa ngalu lue le vaa o le asurus fu fitu Januari sa fa peona no fo isfa no fo isea ma va ai ma tanga luenga ma fa ya la to suenga ale tu ina to o le fale ma o le tanga sa fa ngaluenga fo la le sa no fo le no fuanga le isolation se fulu aso na no fo isea ai ma na fa ia uma suenga ia mauti no negative ai le tu watu lo la to ainga o le tanga sa fa ngaluenga fo ilea positive mai anafi sa fa apea na ave ese atu ma le isolation i la sus full fa February ma la tu i la sus full lima February ma la tu lo la to ainga ai pe tai sa tu e bala awina ta sa fainga luenga le e sa we fainga luenga i va alianza no me ya February full fitu O lona winga e lua aso sai e tangata whainga luenga le i tua malona ainga. Ina ua moa mai le suenga na nafi o tangata whainga luenga le wa positive. Sa e lo se manatu o le matanga luenga so e fu maloloina. E whaapeo na wina atu nisi o lau whainga luenga se i whai suenga le ainga o tangata whainga luenga lea. O le aso ana nafi le afiafi sa whaapeo na whataunu ina ia fuafuanga ma a wina atu ai le tima DOH e whai suenga le ainga lea. E to a valu na te tonu o le whale. Ai to fitu na fo ina test positive. I le aso ana nafi, le afiafi le aso ana nafi. O lea lau na fona i loma tanga luenga mwhapea ma maua i lei unga o atu le wha mai i tua i nuu i a inga lo nufo mai tua. Ma sa su fai fo i su enga. Sa whapea fo i ona whiewa i a inga i le weekend sa o le lotu sa o isi fufa uma sa whianga i ai. Lona winga wa iai le wha mai tua i le community po tua i nuu malalawhanga. O le mela le wa ero se manatu. O le amata loa na whaia fufuanga a wale le tau controlling o wha mai i tua i o tato nuu malalawhanga. This time I will turn over to Dr. Aifidi to explain more on the test and then I'll explain more about the DOH plan for fufuanga matanga winga. O le fo i meo tupu mai newa i le aso nafi. Whaftai.
Thank you for the opportunity. It is my pleasure to give an update of the situation here. On the 17th of February, last week, Thursday, a flight from Hawaii arrived, bringing in how many travelers? 278 travelers. 199 are at Tradewinds Hotel, 33 at Fatuainga, and 55 at the Sadie's by the Sea. 287 travelers to be exact here. Upon testing, all travelers tested negative for COVID-19 except for one traveler from the Fatuainga quarantine site. This traveler has since been removed and placed into our isolation centers. However, at one of our quarantine sites, a staff member had tested positive as well. When we looked into the status here, this staff member was tested positive at a quarantine site where no one else had tested positive. So we had to find out what had happened, where was the exposure. This staff member was also part of the staff that dealt with the flight that came in on the 27th of January, where we had to remove from our quarantine site after finding out that one of our staff members there had been exposed to a traveler who tested positive. Further investigation, we sent a team to this particular staff member's home to make sure, to find out whether when they left isolation on the 15th of February, after being placed in isolation because of their exposure, we sent a team to find out if what had happened and whether this particular staff member had been infectious during the time when they were at home. Upon testing the family members, there were 8 tested, 7 family members out in the community had tested positive. Further investigation also revealed that these family members did engage in several activities out in the community, such as funerals and churches and also other school functions. And so because of this situation and understanding how infectious the current Omicron variant is, and we're suspecting that it is Omicron variant because over 99% of all samples that are positive and have been sequenced in the United States where the flight came from was of the Omicron variant. We know that it's very infectious, and the chances are that it has already spread in the community, and we are now declared that we have community spread out there. So that is the situation right now. And then the Department of Health, we've recommended to move on to the code red status so that we can prepare for the response out in the community. We are looking at putting up test centers out in the community, one on the west side, one here in the central area, and one in the east side, so that anyone who wants to come and get tested, who have symptoms or believe have been exposed, can go to these site locations after calling our 219 number to get tested and then also be evaluated for treatment. One other thing that's very important at this point is our vaccination. Data from all over the world, in the U.S., and even some of our United States affiliated Pacific Island nations, data suggesting that if you're fully vaccinated with a booster, you are well protected from severe disease. We also know that when you're fully vaccinated, it's not necessarily going to stop the transmission of the virus to other people. However, it will protect you from severe disease. We are also going to be standing up vaccination centers, also located strategically in the east side, here in the central location, and also west side, so that you will have the opportunity to come out and, one, if you have not received a single dose yet, it is the time now to please come in and get that shot. And then also, if you have not received a booster and have, it's been more than 5 months since your second dose of the Moderna or Pfizer vaccine, to please come out and get boosted. So that's some of the things we're putting up right now. The teams will be going out to these sites to walk through and then establish, and then we'll be outfitting them, and hopefully they will be up by, are we looking at, by tomorrow, by Wednesday. That's all my update at this time. Thank you for the opportunity.
Ya mole tere whakatai le whamai a tatai pini, me skoi le sunga a tato mau. Te tuatu ia le sunga a tato Francine, tu sai whamu tu langa o tato plan e sapsapai ai le ila tu nua tu sai ma tui, ia e me se fo ia le lato testi, ma whawalo.
Good morning, and thank you for tuning in. What's going on? So, kayo na may mo may relate sila nawali ni kasal lang ng kapitso. Kaya nagsaoy, kumay, kung sa tuwina, ilay sa PI, kung gabalewa, code red, taxo, kung no, kung was tawag, taxo pama. Mantua, ito yung lang manua, sa taxo, may coverage, o ilan, so umalang ako may at so, lewa, bago sa food, kasi na taxo coverage. So, e anga wa amol tui. Balu se full pasene le na ye tato. A ole fautuanga le officer so I forma lo loina. Ole au ngā malitau o atato tui pui puia. Ina awa ina I maitinga ina sesi. Pe o ole tūlanga I o atoi o ele falma ia tato. O ne mua lava nā le e tampai atu ye le officer. Ina ia awa ne I o sesi se tūlanga. O tinga ina, pe mana o mea o na whaatopetope atu le whalmai, na whaamanawa I se masini. O le whaamai nei o le COVID mana tua. O le whaamai o le māmā, o nono winga, o I lato umalawa o ngasingasea, po iei se tūlanga whaalavelave ona o le mānawa, po o le māmā. Maua loa I le whaamai nei, whaateleina le whaingatā, whaateleina le tinga ina, ona e le mawhai o na mānawa. A o I lātou umaleo o mai malanga, tātou tangata ina whaalotia mai whafo o mai mai a lātou tui pui puia, whai o lātou tui o booster. E o mai lea so, ele I iei lava sesi na mana o mea o na whaatopatope o whalemai, pe whao ngā aia tātou waila au nei e tong whiti ai le COVID-19 fuluiva. Tau sanga twaila I mata uma nei e le ofisa e maise le malo, a whai wo o le taime whailau tui pupi o le booster. Mana o mea lava no mai wha uma tātou tui o le vai aso nei, o le amata lia o na tui tatala tātou no fuanga o tuinga. Mawai lava no ai whai ei lau tui o le booster, pe a whai o 5 masina talu na whai lau tui longa lua, o le Pfizer, po o le Moderna. O I lātou na whai le tui o le Janssen, matua e tasi le tui o le Janssen. A whai wa 2 masina o pasi talu na whai lau Janssen. O le taimi fo I nei la whai lau booster po anga wa I lau booster. O
O le whainga lao tātou tui pui puia, pe una sila fia lava le atunuu. Mai le amatanga sa tumutumu lava no fuanga i whalmai ia no fuanga o tuinga. Sa luai ono lea wa pepesi le whaamai tua, o le atamu whai lava ina ia whaia tātou social distancing. Lono winga e le mawhai ono mai to o tele il tai metasi, o le ali miti le au whai o tangata i mawhai o na whai tuinga i aso taitasi o le tātou no fuanga. Pe ona masani ai o asonga fua aso lulu mas whareile. La whapena o na whaamatala tātou no fuanga o tui, wala au te le atuai le malo le atunuu. Pa aiane tātou schedule, o le alu atu i tātou PSA, pe telefoni mai foi. Ai le io atu i tātou no fuanga. O a tātou no fuanga lau tuinga, o le a whaise no fuanga i o le tui sasai, o le o ngā titonu, o le tui le sifo o tātou motu. Pa a whaingo fie no atu ai le malo le atunuu e whai a tātou tui. A o atu fo i no fuanga, o le a whaatulanga ina a whai o oe o se tangata e ti alu atu e whai lau booster. O le a ese se tūlanga i whaano fwoi oe tsono o tātou no fuanga nei, a whai oe su atu e whai lau tui o le tui mua ma le tui longa lua. O le a whapenana whaatulanga ese fwoi susu atu e whai atu tui pui pui ai tātou no fuanga. Talanga umanei a whape mana o mian whaifasili, whamon mole wala au mai tsono o le tātou ofisa. Ai tau sanga tele atu o a tātou tui nei, e tā ua, aua nei i mai tinga ina sesi pe a maua le whaamai. Au e fwoi nei mana o mian whaatope atu i le whalemai. O a inga po o mātua mō whanau e leo anga waa lato whanau i mole tui, lato umanei lalo mai le 5 tau sanga. O le taimi nei, pui le lea tātou whanau lea o lea ua tāpunia uma o onga, lono winga, au le wheo ai tele. O le whanau la iti le foi, a whape maua i le virusi, o la tau nei e le maulua a unga o le whaamai. Ai ia whai uma ni mask o tamaiti, ta ofi le whale, au le wheo ai taimi nei, a whai o nisi o atu whai se whaataunga, pe o mai whafo le whale, manatua ia whaonga le lea tātou ta o disinfect uma 5 ea o lava, sui uma lava, pe au atu loi tutono le whale o lo iei ni ta māma ti nā matatua ea ai meisa le whanau la iti lalo mai o le 5 tau sanga. O ta penanga uma nā tātou ia tātou a inga mana o mia o na whaamalosia mai le taimi nei o na o pepesi tātou whaamai i tua i tātou community. For our English-speaking community, thank you for tuning in right now. Regarding our vaccine updates, right now our coverage is about 80%. And now that there is evidence of community spread, we would like to continue with the vaccination distribution. We will have our sites open starting tomorrow. We will have a site on the eastern side, central, and western side. They will most likely be available on Mondays, Wednesdays, and Fridays. So because yesterday was a holiday, we will begin tomorrow and also on Friday. Right now, we are trying to finalize our hours. We'll most likely be from 8 in the morning to about 2 in the afternoon. But I want to remind everyone, because we are now in code red, there will be a limit on the number of people that we can serve or provide the vaccine for each day. For this particular week, we advise that you come in. If you're due for a booster, you're welcome to come in. If you're still waiting for a first or second dose, please look out for the schedule. Now is the time to get the vaccine because we have seen with all our residents who've come from Honolulu or traveling back home and have tested positive, if they were fully vaccinated and even had gotten a booster, none of them had shown any severe symptoms for COVID-19. In fact, we have not seen anyone who developed severe COVID-19 symptoms that needed to go to the hospital here in American Samoa. So I do want to encourage all of you who are due for a booster, if it's been 5 months since your Pfizer, 5 months since your Moderna second dose, now is the time to come and complete that. If you received the Janssen vaccine and it's been 2 months, you are now eligible for that booster dose. So look out for the schedule this week. It is important that you remember this particular virus will attack those with lung problems, breathing problems. All of those who have trouble breathing right now, once you're exposed to the virus and you get sick, you can develop severe symptoms that include very hard time breathing. You may eventually need to be taken to the hospital to use a machine or what they call a ventilator to help you breathe. But all of those data that coming from off island for those people who do develop severe symptoms are among those who are unvaccinated. And so with our coverage right now and the few people, about 4,500 plus who have not received the vaccine, please come in this week to get the vaccine done. Our elderly folks who are due for the booster, strongly encourage you to come in and get the booster. For the homebound patients who have trouble coming in, please call 219. We will do our best to get to you to give you a dose of the vaccine. But right now I ask for everyone's cooperation. If you've got children younger than 5 years old who are not eligible for the vaccine, parents, families, please take extra precaution for them. This means limited people to come out or leave the home. Make sure everyone in the house has a supply of masks. Make sure that if someone is coming to pick up groceries or go shopping, that when you go home, you disinfect yourselves, you change your clothing. All of those things need to happen now in order to protect those who are most vulnerable, to include our children under 5 years old. So we will have our vaccination sites open tomorrow. Please look out for our schedule. We will push out the hours so that you can come, but please, we are asking for your cooperation because we will be limiting the number of people we can serve at one time so that we can observe social distancing and decrease any transmission while you're coming to get your vaccine. That's all I have for now. Stay tuned for more. Thank you.
Po mai Dr. Francine tu sai foi ma fa ma mohinga tato proklama la wanga iluma tu sai man nei vai aso tu tuila manua o tu langa fo yo tato sa uniuninga peina malele la fionga ko vana le po ana po wa yai nei tato I le code red o tu langa la I o tato code red le fo mato fatasi atu male a fionga I le AG lango awa foi se fa manga o tūlanga nei ai I to tonu o le tātou code red o pisinisi uma o fale o loa o fale ainga o lo sapsapaia le soifua maloloina o le atunuu ia o le a le mawhaina no nofo I to tonu nisi tonu o fale ainga na o le mea tau o le take out o to tonu foi o tātou fale o loa e li miti no numero tangata I tonu o fale o loa I le sefulu e wha malu lua tu foi o le a le ain tātou a onga mo nei vai aso, le ais tātou daycare, ia e tūlanga foi ia o tātou lotu, ia o social gathering, o le a le moa foi sewa noa mo ia tūlanga, na o oe lava ma lou a inga mal whanau e tau ona tonu o lou fale, po o lou lawa, po o lou maota. Ai, o le a lava le mea e tupu, tātou malo loi o tātou a inga, ia ma make sure o lo fai mask al tato whanau o puni fonga ia ma tato ngalulua I le social distancing ia a lo tato iai fafo. O lo iai fo ina I o tato a inga o le a test positive I se teimi o iluma pule o lofa le atua o le a fai fo I whaatanunga fo mai ina ia no nofo la tau le fale awane I o se isi, awalavane I o se isi tūlanga. Ai o le atu numera le soifua maloloina ia mata ona wala au mai ai ia awa foi tūlanga I o le tātou testing ma le tātou vaccination. So tae awa iai wha moe moe o la tatala uma I le valu tātou sites e tolu sites mo le tātou vaccination, tolu foi sites mo le tātou testing. Mo le tātou testing wala au mai tonu le numera lua tasi iwa o le atalia tuai le fo mai po le teine tausi mai na ia wha malamalama tūlanga ia ona e saule tonu e whailau test. Ai awal tātou mai umar teime tasi, na I te ua overwhelm le tātou lab, ia ona tupu pwere nisi tūlanga, te e fua mai atu nisi tangata, man wha alo alo. O tūlanga o le tātou vaccination site, e iai te tātou nunga o le a whaali imiti tātou numera, iai steimi o tu watu leo numera lea, ina ia tau mawhai lava ia awane I tele le whewai o tātou tangata. Tātou ngalulua pe ilunga o tātou virtual, tātou telefoni, ina ia mawhai ai o na maua statu of so ta inga. O le numera lua tasi iwa, po le ale ai o le ono tolu tolu, lima valu fitu tasi. Ono tolu tolu, lima valu fitu tasi, o le atali atuai se isi o le soifua maloloina pe a e vala au mai. Ai awar wha pole o tātou tangata, ia o le a tātou ngā lulue whātasi, i tūsai matūlanga ia. O le tātou seaboard, ona o le soifua maloloina o le tātou watunu, ia o tūlanga ia o le a ngā lulue ai, ia agents, ma le soifua maloloina, ina ia mawhai o na au mai tonu o loa o le tātou watunu. O le a whaila ua na whaise whontanga ma tātou agents, o lo sapsapaia ia tūlanga, ina ia maua pēr le whaasoa mai o tūlanga ia a wale soifua maloloina o le tātou watunu. Ia o tūlanga fo ia o whale mai, o tātou clinics, ia o tūlanga fo ia o le atatala i le vai aso atoa, ia a wā fo i le servina tautuaina o oe tutuila mamanua. Ia, o le tātou code red, e wha mole atu ma whātalosanga atu i employers o le tātou private sector, o tangata essential uma, po tangata e tāua e te tau o mai to tonu, ina ia whaanga i oi ei ia tūlanga o lautau tua, o tūlanga lava ia o le a whai lau whai unga. Ai so se mea lava i te tonu o le ngā luenga, te tau lava na toa se fulu tanata, aua le ova i lunga se fulu tangata o tangata tāua ia e te tau o mai tonu. E whaatino ia ngā luenga. O le a tātou ngā lulu e fo ina ia whaia ia tūlanga, ia ma le vaenga leo leo, ma le vaenga le Homeland Security, ia mai e umai tau tuaina le tātou tunu. O le moli atu ai tele le whawhetai. Ia, masalo le teimi nei o le atu loa se mōnai fesili, a umalo an tātou whawhesilingia, o na tu atu leila nā fionga a wā fo isana tūleinga e wha e anga tonu ai fo ilo tau a fio mai le nei tai au, o le moli atu ai tele le whawhetai, tu tuila mamanua, ona o lau teimi, whātāua mō lea po kalama. Ia, masalo le teimi nei o la tātou atu loa mō nai whawhesilingia, mai le tātou TV, ia ai mese fo i le tātou vaenga lo mātou whātasi nei le tātou headquarters, ma le whaalo alo tele. This time, American Samoa, we will quickly move to our Q&A. Right after our Q&A, Honorable Lieutenant Governor Ale Talawenga will make some closing remarks just for this session, and we'll have more sessions like this in the future. So at this time, we will open up for a couple of questions. Over.
Hi, Director. Director, this is John Rayner. Can you guys hear me okay?
Yes, sir. Go ahead.
Okay, this is John Rayner from KVZK Radio. If you could kindly, a lot of people were asking about where this person and their family members were at. We know that it was someplace in Leone. Can you specifically tell us what church or what functions they were at? Because a lot of the residents, especially in that area, want to know if they might have been at that same event and came in contact with those positive cases.
Thank you, John. We'll turn that question over to the medical team.
Thank you for the question. So we're gonna, later, maybe today or tomorrow, we're doing one of our press conference. We're gonna announce where the family was moving around, like if you, the church, the funeral, if you were gonna be in one of these places that the family move around, we're gonna announce it that the sites where you can go and get tested.
I see. And my follow-up was, can you tell us where the controls broke down, where this exposed person was able to get out of quarantine and get into the public? Was it a false negative test, or can you elaborate on how this whole thing happened to start with?
Yeah, thank you, John. Like we had mentioned earlier, this particular staff member was part of the staff that handled the flight that came in on the 27th of January. They were part of that crew who worked in the quarantine site where one of our staff member had been exposed to a traveler who tested positive and had then been removed from the quarantine site into isolation. This particular staff member was in isolation for a total of 11 days. They were tested, I believe it was every other day, to assess whether their exposure had, transmitted the virus to them. All the tests for this particular person did come out negative. However, we believe that somehow the incubation period was most likely longer than what we had anticipated. And when this individual had gone out to the public, it's more than likely the viral load then reached a certain point where they were infectious. And when they returned to work on the 17th of this month to be in the quarantine site to handle this particular flight, they were tested after 4 days of being in quarantine, and that's when we realized that the staff member was positive. We wanted to find out where exactly the staff member had been exposed, because everybody in the quarantine site, as far as the travelers were concerned, had tested all negative. So we sent a team, understanding that this particular staff member was in isolation. We sent a team out to their home in fears that they might have gone home and taken the virus out with them. And upon testing the family members, it was then revealed that the 7 of the family members had tested positive. So where had this been the leak? According to what we've done, we've followed every single protocol that we have put in place. Unfortunately, it might have been missed before this particular family member had left out to the community, and that's where the spill that happened. I hope that answered the question.
Thank you, Dr. Philip. Thank you, John Rayner. At this time, because of the time, we don't have that much time. I want to turn over to Enoka. You have one question from Olmole. Go ahead. Mr. Enoka Tupai.
Can I ask them you'll pay me Enoka?
Director, I have a question from someone else.
Okay, go ahead, Philly. Thank you.
Thank you, Director. There's on the issue of the Starkist Samoa. It says that the code break business still operates from 5 in the morning to 4 in the afternoon. How about the cannery? It's the largest employer in the territory, and they're still in production. Are they considered exempted from any of the provision of code break? And what are the exemptions?
No, they're not being exempted right now. They're supposed to be standing down, but they're only supposed to have the essential people in to make sure operation continue. So that call will have to be by the management, and also advise the public health and homeland security on those issues. But for now, every organization, every business, school, church are supposed to be closed for a week until we further assess the situation on the ground. Then we will advise the Honorable Governor, Lieutenant Governor, and also the task force. Hope that answers your question.
Thank you very much,
Okay.
sir.
Thank you, Philly. Let's go up to Mr. Enoka. Are you still there? Okay. While Mr. Enoka is trying to get in, let's turn over to the TV.
Could you specify on buses?
John, hang on.
Can you clear up buses, are buses allowed to run? Sorry.
Essential buses, they have to run in order to take care of those people that are working. Essential personnel only, but they must have only 10 passengers inside those buses. Large buses, 10. Small buses, we go down to 50%. How copy, John? Okay. Thank you, John. TV?
Okay. Malo, thank you, Lieutenant Governor, DOH staff for all your work. So what's happening to the family now? Are they being isolated or are they home quarantined?
At this time, the family had been asked to be isolated at home at this time.
Okay, and is DOH still following up on the testing or checking on them so that they don't move around?
Yes, we have teams that will be contacting the families on a daily basis.
There's been a lot of panic buying. Last night after the meeting we had here, there was a lot of traffic. A lot of people with crowded shops to buy stuff. What advice can you give, to our people to prevent them from overcrowding shops at this time while we're in lockdown?
Thank you for the question. So like it's already been mentioned that it's elevated to code red, and for any social gathering, it's only 10 people. So that we have to inform the businesses and how to coordinate those in their business, like wearing masks and social distancing and all that. So it will announce only 10 people are allowed inside, and then the business will have to make sure that they enforce those protocols that we sent out to.
And we also advise the public, please, remain calm, try not to panic. Like what was mentioned earlier today, more than 80% of our population are fully vaccinated. Data still shows that if you're fully vaccinated, you are protected from severe disease. However, if you are one of the individuals that you are at risk of having severe disease, for instance, those who might have other pre-existing chronic conditions, those individuals, if you do have, you start to develop symptoms that are consistent with respiratory infection, to please give a call, 219, and we'll direct you to where you can go and get tested. And at this time, although yes, we are in code red, however, the stores will still have the operational hours from 5 a.m. to I believe it's 4 p.m. or sometime in the evening. There's ample time for you to schedule to go out to get the necessities from the stores that you will need. However, knowing that with code red, there's going to be a capacity limit at some of these stores, and that we're asking the store owners to please to follow suit and make sure that there's social distancing happening in the stores that they're at. If you remember back in 2020 when we had the total shutdown of our government, as we closed the borders and also doing our mass testing to see if the virus did seep in before we closed the borders, we went through this before. We're asking the businesses to please bring up those protocols again so that we can protect the population and minimize the chance of transmission at this time as we prepare to transition from fighting the coronavirus at our borders to now going into the community. Thank you.
Thank you, Dr. Ifili. I think we have time for one more question, and right after that one more question, we would like to turn over to Dr. Fred Early, the director of the VA clinic, and also Dr. Cecilia from Honolulu, representing our medical team in Hawaii for some comments and also advice. Then we'll turn over to Honorable Carr for his closing remarks. So one more question, please, ladies and gentlemen. Monica Miller, you're on.
Good morning, everyone. Yes, since Enoka isn't on, I don't want KHD to hog the time, but is there any revision of the conditions of the different codes, especially code red in light of the Omicron spreading, because these were drawn up during the time when Delta and other variants were the issue, and now we have a different variant altogether, please. Thank you.
Thank you, Monica Miller. As you're well aware, situation on the ground will dictate what's going to happen, and that's after we brief the medical team, come together, we brief the task force, and also the AG for some amendment to our current declaration. So that's an ongoing thing right now. As we discussed earlier, we're giving room to our port to make sure we don't skip any of the economy, the needs of our people in regards to the goods that are coming in. So those are some of the things that we're looking at and weighing in regards to the code red. But bottom line, code red is code red. Everything's supposed to be shut down. And we'll also evaluate, talking to the Homeland Security, Agriculture, also the hospital and our DOC. That's where all that advice will come from in regards to moving forward with our code red continuation for the next week or so. So I hope I answer your question. We also have the assistant
Yes.
AG over here to comment on that. Monica Miller.
Yeah, thank you, Director. This question just came in from Manua. If DOH will send COVID tests to Manua, there was a supply boat that came in, and there was a large group from Tutuila over there, and the people there are worried about potential exposure. Now, they also want to know when their booster shots will be available. That just came in.
Roger, thank you. Right now, aircraft to Manua. We will also assess the health of Manua, see where we can bring in their boosters sometimes next week once things start settling down. But the bottom line for us is to stop any movement between Pango and Manua for now until we assess the health of our people here in Pango moving forward. And we have also, with big high consideration to our family members in Manua. So Manua, we don't forget about you. We love you, and we'll try to continue to support you in any way we can, making sure that you all will receive your boosters sometimes in the future. One more
Director,
from the TV.
Director, sorry, this is not a question, but a rather request from members of the public. I'm looking at our feedback from our coverage because we're live. And people want to know if you could kindly explain to them what the code red restrictions are, because a lot of them are not aware of what the restrictions are.
Thank you. You can find our declaration on our ASG website, .gov. But we're also trying to update that in regards to the need of our people and also the support that we're providing to our folks. I look at, when I hear code red, to me, everything is shut down. Everything is shut down with certain conditions to all essential needs for American Samoa. So if you provide service for the people of American Samoa, and you know that it's an essential service to our people and their health, then you are an essential service. Just make sure you have less than 10 people that are operating in your area. But if you do have any question, please feel free to call Public Health and also our Office of the AG, Homeland Security. We will definitely explain that. But I do apologize because situation change every day or every week. So we have to respond to what situation that's going on, currently happening on the ground. So thank you, American Samoa, for your patience. Is there any more questions before we turn over to Dr. Early and also Dr. Cecilia? Okay. Assistant AG,
Yes, I think that just to expand on what the director said in regards to essential services. In the private sector, if you have any doubts whether or not your business falls under essential service, if you have doubts, the best thing to do is do not open. In regards to essential services, if your primary business is food and household supplies to the public with the restriction of 10 customers in your store, you would most likely be a essential service. If you're a pharmacy, you are a essential service. So in the private sector, if you have any doubts that you are operating essential services, then please close down. If you have any questions, please contact the Department of Health or the Attorney General's office. Leave your contact information, and we will get back to you to evaluate whether or not you fall into essential services.
Okay. Thank you, Council. So, this time to Tuilima Manua, I would like to turn over the floor over to Dr. Early, if he's available. and Dr. Cecilia for some recommendation. Very quickly before we turn over to Honorable Carr for his closing remarks. Famole lava, over.
Thank you, Director. This is Dr. Early. Really don't have much to add to it, since I'm learning as well as everyone else in the public of what has happened over the weekend. I think it's really important that there's more transparency provided to the public and that we identify the village and the areas where people may have been in contact with the positive individuals. I think otherwise you're going to have panic and everyone want to rush in for testing when it's really not necessary. I think if you try to identify those areas where people may have been exposed, caution them about exposure, caution them that it may take as little as a day and a half before they start shedding the virus if they become positive, and well before their symptoms. That type of education and knowledge will be helpful to minimize the spread. If everyone panics and rushes in to get tested, then you're going to expose more people. So I think more information about where the exposure was, what events these people attended, and trying to identify those others who attended and keep them isolated, keep them from getting out into the public would be quite helpful.
Thank you, Dr. Early, for the advice, medical advice to the director and also the team. Right after Dr. Cecilia will turn back over to the medical team to address that portion, then we'll turn over to Honorable Carr for his final remarks. Dr. Cecilia Famolmole, you have 30 seconds.
Thank you very much, and especially to our entire ASG staff there, also to the public and our media outlets for getting this important information out. We've long been planning for this moment. We were trying to stave it off as long as possible, and that was possible because of the work of the community all together. And now that we've stepped into this phase, this is like a phase 2. This is where the virus begins to, we do see it as starting to have a spread into the community. When we look at other areas that have done this, there was a very critical 1 to 2 week period before we started to see cases rise. That's where the stage is that we are now. And in this critical period, there are 2 things that we need to do. One is to contain, and the second prong is to care and set up our care mechanisms. The containment is what the governor and lieutenant governor have done in the way of a code red. That is to allow a period of time to assess the situation and contain as far as possible. Just as following up with what Dr. Early said, the contact tracing has begun already as soon as that staff case report came to light, and that is being done right now with the DOH EpiNet team. In the containment part, then of course we will all turn our eyes to EOC and to the Department of Homeland Security and Department of Public Safety to help map out things. But it is the DOH EpiNet team that will be gathering data from the hotline, from the clinics, from the testing sites, and all of this information will help us know where these hot spots are going to be popping up. And that information then is relayed over to EOC. They will be mapping out the strategy of containment to, first of all, to facilitate that there is continuous supply into the community, to facilitate the essential workers and their movements, but to limit unnecessary movement as much as possible. They will be there also to facilitate the functions of the Department of Health. Along the care prong, so that's containment. On the care prong, that is what Dr. Akili and Dr. Almoa have been summarizing, and that is that we will be focused on identifying, early identification of any cases and isolating. So the big message there is the number one way to protect our community from severe illness, which will overwhelm our hospital system, is to vaccinate. So again, this critical 1 to 2 week period before there's more and more spread is that we cover as much of those who are not vaccinated and those who need boosters to get that underway, because that is what will protect our hospital from severe illness. And again, on the care side, also is that to the public, to keep it very simple. If you're feeling any flu-like symptoms, isolate that member of the family in a safe room, support them. Call 219 over to Department of Health. You will be receiving instructions as to, they'll be asking some questions, but receiving instructions of where to go and test, what time to and where to go test. Some testing sites may be a drive-through, some testing sites may be an open pavilion, fresh air setting, but you'll get those instructions. And then, so the number one, isolate the member so that other members don't get infected of the family. Stop all visitors from coming over. And then number two, call DOH, call the hotline 219. This is where all the data starts to be collected, and that's what we share with the EOC. And then number three, go in for testing. From that site, we will get more data as to how many positive cases are out there, and we will then be triaging people accordingly. Those that need to go to receive treatment because they are high risk, they will receive early treatment of some antiviral medications that are available. For those, the majority of people, and again, this is where we should avoid panic. The majority of people will have mild, if not any symptoms. We're talking about over 90 to 95% of persons will be that. So that's why we need a triage system. And we also would like to just ask that everybody remain calm, help one another, and if you know somebody that goes into isolation, support their family unit by you can drop off food to them. But again, just try to minimize unnecessary movement. Thank you very much.
Tele Dr. Cecilia from Honolulu, mole apopo inga, ma lo lava on site. Pele leile tu atu Dr. Lauvao ma Dr. Aifili tu sai ole tala no mai Dr. Early. Now sina from talanga pupu lava pole east, west, south, po feo o tu poina I fala blave ia. E awai fo ile overwhelm le tato sites. Ma falo alo ia tu atu le na fionga. Honorable, Asia.
Yeah, I just wanted the opportunity to
Okay.
confirm the importance of transparency. On behalf of the panel, I know that the President of the Senate and my colleagues, senators, and the Speaker, we've all been able to meet this morning and talk. So they also wanted to stress the fact that our community needs all the support we can give to DOH, and do not panic, but please help. As a representative from Leone, I can come to the people to tell them the truth, that the family members, it's my constituents that are also from Leone. I was able to also know and find out that the church is not in Leone, the church is here in Nu'uli. And a lot of these members were exposed to the staff that was helping out clean up the church. So the importance of isolating and people not panicking and all flooding the phones here at DOH, please, don't panic, but please offer support and try to be safe. Also, I wanted to stress the fact of contact tracing, because if this staff was out there for a few days being exposed to church members and also in the village of Leone, please isolate yourself, because this past Friday, the governor and the speaker were at an event in Leone involving the high school. So that's another area that I know that it's a possibility of family members that are 7 of them that were attending that event. So that's all I can say, the importance of transparency, tell the truth, getting support from our community to the DOH and the COVID task force.
Ma lo le ona sai whaftai fo i tātou what's new. Yeah, Dr. Lavau, ma Dr. Ifiri, would you like to comment on Dr. Early's advice? Then we'll turn over to Honorable Carr for his closing remarks.
Yeah, thank you for the advice. Like we said, the investigations are still ongoing. We want to make sure that everyone is protected. We will be revealing these information once everything is gathered. And also want to remind the public that all of this happened very late in the afternoon. The deliberations by the medical community ended very late last night. So all of this information is still coming up. We want to make sure everything is solid before revealing, and also making sure that when we are revealing some of this information, that we're doing it by making sure that we're following all the laws. We also understand that there are things in place to protect the privacy of the individuals that we're talking about. So it will be revealed, but at this time, more information is being gathered.
Tele Dr. Ifili, salo taimi nei tule manua, o la tu atu loi lana fionga, awa foisa na malulenga, awa e anga tonu ailo o tou a fio mai a whaftai a tele, sa foisa taimi wha matu mato whamtalanga, o la tu atu loi lana fionga.
Tai lau sunga le tai tai ia e whatalo whatu fo i le malo tatu atu nuu nei tai au ua tātou whatasi fo i ono nisi o suinga o le tātou whamai ia o le talo lava e pe ona saunua le fionga le kovana nafi o tātou ua ia i le code red ia ona o tūlanga ua pesit whamai. Masalo se tūlanga nei sa tātou pole ai i le taunu mai o le whamai. Ia ai o lewa foi ona tātou nofo sao niuni i tausanga i tele mo le aso le nei. Le aso le nei e taunu mai ai le fionga ia COVID-19 i tonu o le tātou atunuu, ia masala lau atu i le atunuu. O le e langona i fo i le anganga o le whaftai ma le fia, oli le atua, ona o le tele o ia aso na pui ai tātou ma le whamai. Ia le nei wa tātou o mai le nei suinga fo i o le tātou soifuanga. Ia Amerika Samoa, malu o tātou atunu, ia tūlai mai i tātou ngā lue whātasi. E le whaingofie le ngā luenga, o le a tātou whaasanga atu iai. Ia ai au te talitonu, ia lofa le tua i Amerika Samoa. Ua fua i mai fua i le tua i a upenga i ese. E mawhai ai ona tātou whia ngai mal whamaa. O le tausanga na le nei au na vai le malo la tunuu We have community spread. We have confirmed community spread in our community. And so we have officially reached phase 3 of our efforts to deal with COVID. The first was repatriation, second was commercial flights, and now we have to, this is the phase where we learn to live with COVID. And we expect this phase will be with us for some time, and that we will eventually learn to adjust our ways and to figure out how to live with this sickness. I'd like to ask all of our frontline people to prepare yourselves and your families for the days ahead so that we can execute the wishes of the governor and our leaders to make sure that our people are protected. So Code Red has been instituted essentially to provide us some time off to figure out how wide the spread is. So we hope and we expect that everybody will just agree to just stay in place and not go around, because the more you go around, you spread the disease to other folks. But to just take this 1 week period to stay at home with your families and learn to be together as a family until we figure out where we go from there. Don't panic. The stores will always be open. We're not locking down the stores. Cost You Less is going to be open, and Kmart and all of the important stores that people like to go buy their groceries from will be open. The container ships are still going to be running, so don't worry about any shortage of supplies. We have a number of ships that are expected to arrive this week and next week, and we're allowing them to come through. So like I said, please be patient and allow this downtime for us to reassess and figure out where we are. Like I said, when we closed down in 2020, we didn't have a vaccination. We didn't have any antiviral medication, and we didn't have a lot of the equipment that we have today. But we do that. We have over 80% vaccinated coverage, and we have antiviral medication. We have a good supply of testing tests and a good supply of vaccination. So this is the time for us to get all those things done. If you haven't been vaccinated yet, this may be the perfect time for you to come get vaccinated, get boosted, so that we can protect our people. I know a lot of you want to get to the bottom of who this person was, where is she from, where he's from, what village, what church does he attend. In time, all of this information will be provided, but that's the reason why we're going on Code Red, because we believe that the exposure and the spread has gone far beyond her, or far beyond him. So, whaina o e popole i le exposure, the best thing to do is just to abide by the Code Red and stay home. Ia o se whaasoa tuna i le nei tū la o le aso, pa ia mal mamalo le tunu, ia tātou lava papale, ma tātou on sai tūlanga foi o le whamai wa tātou o tiai. Talsanga i le mamalo le tunu, pa ia lau whainga luenga, ia manatua ifo si o tātou atunu, ia tātou tatalo ina ia alofa le tua, e sosoani mai a Amerika Samoa, ma le tūlanga o ai fo si o tātou atunu. Mamalu o whaipule, ma malu afi o anga, ia o tau ia o tua ia tu iai le finangalo le kovana, E mese foi le fionga I le whatonsili, ma le malu le ofisa. Ma na omia le fsoswani tatou pule nuu, ia ma le tatou malofa aloto I fale, ina ia mawhai ona whaatino ngā luenga, whai ona whaamalosia ia tatou sae pe ona whaatulanga ina I lalo le Code Red. Ia lofa le tua e whamanuia Amerika Samoa, malu ia li fo mai ma I la tau o la fia ngai ma le ngaluenga, sunga le whaatonu. Whamanuia fo I le tua ia tatou taitai, ina ia lava pele on sai, ma ia maua le to mai le langi. Ia e mawhai e ona whaatino a tatou ngaluenga, o se whamtalanga pupu le nei tu la le aso, manu te leina fuafuanga tutoi, whaftai.
Thank you, Honourable Carr. Thank you, Honourable Representative Andra Samoa. Thank you to the doctors and also our media representatives. Thank you to our frontline and all of those who are coming together to support this effort. Thank you for your support of our Governor and Lieutenant Governor and our task force. Ta tonu o si ui o tātou proklama le nei tū lao le aso Amerika Samoa, whaafetai atu tele ono lau teimi whaavanoa. Whaamanatu atu ia awana I ngalo lo ufi whafonga, mask, ma le tātou social distancing. Lewa o malele la nā fionga, ia lofa le atua ma wapea le malosi, a wafo inga luenga tau tu ai oi tu tuile manua, o se lewa pa o papa, whaamangalo le au auna, a iai fo istaimi o luma tu tuile manua, tātou toi wheloa I fo I leisi tātou por kalama whape nei, so I fua tu tuile manua, a meise tau tua mai ma le tapuai mai o tu mua mapule, so I fua tu tuile manua.